Hey everybody, Staten Rebeck here with Revolution Health and Performance, and I wanted to talk today about pain. Most of my clients that come to see me are in some type of pain. That's generally why people see physical therapists, although not all the time. So one of our goals is typically to try to reduce or eliminate the pain that they're in. And so I'm going to walk you through somewhat of an evaluative process on how this is done. So as my job as a physical therapist, I perform a subjective examination, and this is one of the most important tools that I think that is underutilized and often overlooked as a physiotherapist. So during this subjective examination, I'm asking you questions about what led to your pain. Have you had a change in lifestyle? Are you doing things on the weekend that may have contributed to your pain? What does it feel like? What are the symptoms? What are the aggravating factors, etc.? Basically, a good subjective examination should take upwards of 10 to 15 minutes, really digging deep into why you are having this pain. And this is something that, again, I think is overlooked as a clinician. Doctors particularly are pretty busy, and they see patients for 10 to 15 minutes at a time per visit. They don't really have a lot of time to dig deep into the why behind things. So as physical therapists, this is something that is taken upon us, and I think that we do a decent job of, but can definitely do better. So after this subjective examination, we're going to do some tests. This includes range of motion, strength testing, some joint mobility, and a plethora of special tests that we can do to see what mechanical issue might be leading to your pain, what structure can we identify that might be contributing to your pain, such as muscle, tendon, joint-related, nerve pain, because this will influence our plan of care, the treatment that we give you. So after we've run you through a myriad of tests, we think we have a decent idea of what's going on. We will identify your pain source, what we think is causing it mechanically, but we will also try to educate you on things that led to your pain. So lifestyle. We might educate you on some lifestyle changes, some habit modifications that we can do to decrease your rate of reoccurrence. We can educate you on general principles for improving strength, endurance, mobility, etc., so that you can be a well-rounded and resilient individual. One thing that we can do to decrease injuries is just improve our overall general health. So a lot of times I'm educating on, strength requirements for the week, endurance requirements aerobically for the week, how we can improve upon our sleep, our stress, our nutrition. All of these things go into pain. That brings me to my last point, is that pain is something that is very complex. We don't know specifically all the time on what is causing your pain, and most often, and in many cases that I find, it is a bunch of things. Injuries can happen randomly. There's not always a mechanical issue. You can be a week of bad sleep, week of high stress, and these are all things that can contribute to injuries. So understanding that pain is multifactorial, and it's not always your fault per se that you were injured or are in pain, but there are definitely things that you can do to improve upon your pain, and we want to be able to empower patients, empower clients to take responsibility for those things, and just give them the tools necessary to get out of their pain. So if this is something that you're interested in, you can always visit my website at www.rhpmobilehealth.com. I do see clients in person in the Springfield, Illinois area or online. I do virtual training as well, where I can see you as often as you wish, up to weekly. But a lot of my virtual clients are a monthly or even less frequent than that. So again, visit my website. This information will be on there. Follow me on social media. I'm going to try to do more talks like this in the future, maybe about once per week, to really dive deep into some of these topics. I know social media most of the time is just a quick video to try to capture your attention and maybe give you a headline that keeps you interested. But a lot of that stuff is misinformation, and there's so much stuff on social media that it's hard to really cut through what's true, what's false. So I hope to give more of a perspective on these things and really dive deeper into some of these topics that I think are interesting.